Dr. Nikitow. I'm at the World Championship Cheerleading event here in Orlando, Florida. And right behind me we have three of the top world athletes for cheerleading. Okay, we've got Coach Aaron, we've got Zach, and we've got Gabe. These guys are tumblers. They're phenomenal. These guys are on the international team, and Gabe is on one of the world's teams. Anyway, the reason I'm here is I work a lot with the cheerleaders and their organization, and this competitive cheerleading is one of the top sports, growing sports in the country right now. And what I want to point out is that you guys really need to get going with working with a lot of cheerleading groups, because they have a lot of distortions that are consistent. Like when they have these flyers, they're always lifting the same leg and their hips end up getting twisted. These guys are bases and tumblers, and these are the top level athletes in cheerleading in the world. So what I want to do is I want to show you a couple things I'm going to do with them, because obviously it's consistent patterning that's changing their nerve muscle memory, and it keeps getting them out of alignment. So I'm going to take a look at, let's take a look at Coach Aaron first, and then we'll take a look at Zach, and then we'll take a look at Gabe last, okay? So come on over here and just kick your sandals off. So we're at the hotel here in Orlando, Florida, right across from downtown Disney. Okay, so it's the Hilton, and you can look in these hotels. They got great benches oftentimes, and so you don't have to bring equipment. You just need to know the three-dimensional system that I teach, so that way we can consistently change their muscle memory and their pattern. So one of the things, just stand up real quick. What I'm going to do is check his posture real quick. And he's pretty good over here. Yesterday he hurt his neck. How's your neck feeling, by the way?
It's better.
It's a lot better? Okay, so all we're going to do is we're going to really work on his neck, because he looks pretty good over this way. Lay on your back. Okay? And I just want to check his... Yesterday he jammed his neck and he fell and he twisted his whole neck on the right side. So we're just going to take a look at that, and then we're going to give him adjust. Oh, that's like 10 times better. That's awesome. So we're going to adjust his neck. Okay, and I also want to check his hips, because his hips typically have a problem where he's not rotating properly. He's doing really good today. Let me see this one. Okay, that one's a little off, so we're going to adjust this. Now this works better on a drop table, but basically I'm going to take his leg like this, just take it out to the side, okay, and make an adjustment there, and now we can see how his range of motion is increased about 40 degrees, okay? Let's have you lay on your side and face me. Adjust his hip, just pull this up, let this come back. Okay, and go the other side. Now he doesn't have any rotations, but he has a lot of torque. So we're just going to take the torque out. Okay, sit up. I'm going to check his collarbone, because he typically has some stuff off of his shoulders, which is really good today. Cross your arm. We'll let you back. Okay, there it is. Okay, you're all set.
Thank you.
All right. Let's take a look at Zach. Take your shoes off. Now you were complaining that your hip was hurting, right?
Yes.
So tell them what you're feeling.
I feel like I have a pinched nerve in my lower back and into my hip.
Okay. Come on over here. And what I'm going to have you do is I'm just going to have you step in place and keep looking straight ahead, and just let your arms relax. Let everything kind of hang. Actually, close your eyes when you do it. Okay, now stop. Go ahead. Now, the reason you have them moving around like that is because you want to see what the proprioceptors are doing in terms of their firing. Close your eyes, shake around like that. Move your head around a little bit. I can tell you don't dance much, right? Okay, keep your eyes closed. Keep your eyes closed. Okay, stop. Just stop and find a place that feels normal to you, like stand where you're comfortable. Okay, you'll see him shift around a little bit. And then what we're looking at here, come on over here, and I want you to look down film down at my hands here. Okay, now you stay with your eyes closed. Don't open until I tell you. Okay, so now when I touch the front of his hip, look at my hands. Can you see how this one's way back and this one's way forward? Okay, now you can look down at my hands. Can you see how this one's back and this one's more forward if I was to slide my little fingers together? Yeah. So basically we're like this versus like this, which means he's getting a rotation of his pelvis. When they do that, they're going to get a lot of pressure occurring on the quad tendon coming up in here in the rectus femoris. Okay, so basically what we're going to do here, you see how far off this is? Okay, so what you're doing is you're twisting, and when you twist like that, the joints of your low back override, and then what you end up doing is getting this type of feeling on your discs in your lower back. Okay, I'll look straight ahead. Okay, I'm going to check his belly button to where his center point is. Now, come around here, and you'll see that if I drew a line down straight from this point, the suprasternal notch down to the belly button, how his belly button's way off, which confirms that he's twisted in this angle. Okay, okay, go ahead and lay on your stomach. Put your face over here. Come towards me. Isn't this a great bench? I could open business over here. Okay, now I'm going to lift up your arm here, or your hip rather. Let's put your arm right here so you're kind of back like that. Okay, so once again, if you were to look at my fingers over here, you'll see that this thumb is way back. Okay, it's way back this way. He's twisted, so he's what we call negative Y. Okay, so basically, again, this is all twisted. His sacrum's off, his low back's off. He's twisting on his fifth lumbar to the left, so he's actually going this way, and then he's going this way. So he's got a big dish rag going on right here where he's putting a lot of compression. Okay, so we're going to start with the lumbar and just kind of do a few pumps. Perfect. Feel that move?
Yeah. Oh my gosh.
Yeah. Okay, now your sacrum. And then again, you don't need drop section tables. You could do a lot of these things because remember, the adjustment is about the pop. It's about stimulating the nerve to tell the muscle what to do. Okay, so basically as we're looking at, now bend your knees. Okay. Now if you look at his leg length's perfect. A lot of you guys go after leg length, and it's not about leg length because leg length means there's a torque in the pelvis. If you've got rotation, the leg length will often be normal. So you don't look for that, okay? His sacrum's also shoved this way, so we're gonna adjust the apex this way. So he's all twisted. He's this way, his sacrum's up, his sacrum's popped up on the base and shifted on the apex. Now he's pretty even, one more time. Okay, now he's even, and he's even here. Okay, leg length good, checking the fibulas. Always want to check the feet, okay? He's got pretty good movement there, but his navicular's dropped, so we're going to adjust on his feet. Remember, the proprioceptor is telling the brain where you're at. These guys are top-level tumblers. If this nerve is compressed here, and those receptors are not firing, it has nothing to do with pain, he's not going to perform to 100%. So we have to make sure we get an adjustment there. You feel all that?
Yeah.
How's that feel?
That's great.
Okay, now we're going to check his neck. I can see that his skull, just relax here, come over here, and just take a film of him from the back so you can see how low that right ear is. You see how low his right ear is? Okay, now you see there. Okay, so we're going to make an adjustment here for him, but we'll do that on the back. Right here, his neck is off here at C6, 7. Turn your head and look to the side. No, the other way. Relax your arms. So I'm going to come in here, make that adjustment, and of course those are nerves that go down to the arm and hand. We could adjust the atlas from here too, but I prefer to do it on the opposite side so I can get this occiput and everything else adjusted. He's not too bad through here. Now let's get you on this side. You're going to face me over here. Now again, he's negative Y, which means his butt is twisting back. He's pushing back on the right, which is this side. So now we're going to roll the entire structure forward with the legs straight. Got it? Give me this arm. Okay, lean back. So we're unwinding him. We're going back here and forward here. Come closer to me. Good. And we're just going to roll you like you're going off the table. Okay, on your back. Okay, now we're going to set the skull. We're going to set the atlas first on this. And then we're going to set the skull. We're going to drop it down. Let it drop. Let it drop. Now if you look at, come over here, if you take a look at him straight down, you'll see that the skull is now even, okay? The entire structure here. Okay, now let's just check the hip. Bend your knee. Bend your knee. So he's pretty good on his hip range of motion. You always want to check that because if this hip is locked, the hip joint in the socket, he's going to have problems with his low back. Okay, let's get you up, walk around. Now you always want to walk them because when you walk them, what's happening is you're going to fire the proprioceptors, okay? Walking the patient right after you adjust them allows the nervous system to start resetting the muscles. Come on back. Okay, now we're going to recheck them again. Stand over here where you were. Once you stand over there, you can see. Now step in place, keep your eyes closed, and then stop. Okay, come on over here so you can feel my hands. Right over here. Okay, so now when I touch them, take a look at my hands. You see how they're more level, how they're even? Got it? Okay, now walk some more. Okay, so now we're nice and even on the hands. Okay, so our hands now are like this. okay, compared to where they were before, where this one was way back like that, okay? Now what I'm gonna have you do is lay down one more time, put your head way up there, and put your feet over here.
On my stomach?
Yeah, stomach. Now what I'm gonna do is I'm gonna recheck him one more time to see if there's any torque that's hiding, because sometimes what happens is when there's a rotation, once we take the rotation out, something else will show up, like he was translated and he was rotated. Now we're gonna check for the torque, and the torque is where you're gonna end up with a short leg, okay? And we're not seeing that. So come on up again, and just stand here. I wanna check where the belly button matches. Just kind of get relaxed where you're nice and relaxed. Okay, now there's his belly button, right? Right? Is that your belly button?
Yes.
Feels like a belly button. Okay, and this is the point, okay, of reference. Now you see how those are lined up now compared to they were before? Before, because of the rotation, this was way over here. Now he's not rotated, he doesn't have anything. How's that feel in your low back now?
I felt great.
Felt great.
Yeah.
See? So one of the things you want to do is you always want to make sure you're getting with these athletes, making sure the rotations are, because when these guys are tumbling, doing all these weird positions, they do it repetitively. It's their nerve muscle memory that's starting to get involved with that, and then the nerve fires too much to one side and they end up with the postural distortion. So it's not about popping back for pain, it's about changing nerve muscle memory by identifying the three-dimensional postural position. Okay, you're done. All right, so Gabe, come on, let me check you real quick. Okay. And your low back's hurting too, huh?
Yes, sir.
Okay, so you're not too bad this way. So he's not rotated or translated. Okay, face down, put your head over there. So he has no rotation, no translation, but let's take a look at him on your knees. Okay. So now look at his leg length. Let me pull you back. Okay, look at his leg length. You see that leg short on the right? Okay, so what that means, he's torquing. Okay, so that's like a PIAS. And if we look at him here, like I touch his PSIS, he's way twisted back on the side, which is pulling the pelvis back, making the leg short. So we're gonna have to adjust this one forward and this one backward, okay? And that's why sacrums, look at my hands here. Look how this one's popped way up, okay? Now sometimes it's due to the pelvic rotation. In this case, he doesn't have the pelvic rotation when he's standing, but that's putting a lot of strain on him because his sacrum, which is the triangle bone, is tilted way up on this side. See that? And that's where the pressure's coming from. So first we're gonna adjust the sacrum. Just that little bit. Look at the difference in my hands now. You see how these are, this was like up like this. Did you see that from there? Let your breath out. We get T9. Turn your head to the left. We're going to adjust to C6. Good. Center. Okay, now laying your side facing me. Come towards me. Bringing up the leg. This is where the leg is coming up, okay? And we're going to roll the pelvis this way. So we're going to come under the ischial tube, drive it towards the leg. Go on the other side. Actually, put your head over here and swing your feet this way. So as he's filming it. Okay, bring this over here. Okay, you're on your back. You always want to check the atlas and axis. That's where the major proprioception is coming from. This is the control center for posture. If this is off, the rest of the body's off. Turn, turn. Okay, sit up, walk. Always want to walk them. Just take a lap over there. Come on back here. All the way over here. Put your feet over here, lay in your stomach. Okay, now look at the leg length difference. See that? So basically what we're doing here is we're checking. Now, one last thing I'm going to do with him, his fibula is twisted on the left. You see that? So what I'm going to do is reset this. Okay, we're going to check his feet. Make sure he's good here. He's got 2 drop metatarsals, heels off. Heels good here. Excuse me, let me roll right by you. Good. Okay. So our leg length's perfect now. Stand up, walk around. How's that feel?
Much better.
Much better. Okay. So I'm going to be here most of the competition. I'm going to be working a lot of the athletes. I'll be throwing up a few other videos and things. But if you guys want any other information, register for a seminar. We have DVDs, Adjusting with Certainty, where I teach this technique. I'll be at the CCA doing a state association lecture here at the end of May. So make sure you check some of that stuff out on my website. This is Dr. Nikitow. See you later. Okay, what'd you want now?
No,
Hold on a second. Now we were at the hotel. Pan around and look at these guys.
Yeah, we all want to be adjusted.
Okay, now let me tell you something.
Good in line.
Let me tell you something.
We're tumblers
This
too.
is, yeah, he's tumblers too. This happens to me all the time when I'm teaching around the world at hotels, convention centers. They're getting ready to clean up. The next thing I know, I'm adjusting a lot of the doctors. Next thing I know, I get the staffs coming, okay? So I'm going to take a look at a few of these people. You mind hanging out? And filming? Okay, so that's my fee. See, one of the athletes is gonna film this. Okay, so what's going on?
Okay,
That's the battery.
it's been in pain for about probably 4 months, and I do a lot of exercise. I do a lot of yoga, I work out. I'm very active, but I also spend a lot of time sitting on the desk here all the time. So it just doesn't go away. I don't know what to do anymore.
Let me explain this to you real quick, okay? First of all, y'all need to have a chiropractor. Chiropractors aren't back pain doctors. We're nerve doctors. So what it is that, see, the nerve tells the muscle how to pull. Now, people think, oh, I'm going to stretch, I'm going to do all this stuff. But if your alignment was out of alignment in your car, like you had the wheel out of alignment in your car, you could shoot grease in it, you could wash it, you could do all these different things. It was still out of alignment because you might have hit a curb or something, right? So you got to get it aligned. When we do the adjustment, what we're doing is firing a nerve. We're not putting the bone into place, we're triggering the nerve to tell the muscle to pull it differently. So what I'll do is I'll have you take your coat off and I'll check it for you. And I'll show you what's going on. Then we're going to have to hook you up with a chiropractor here in Orlando, Florida.
Sounds good.
All right? All right. So give them all your stuff. All
So
right.
you're obviously not from Orlando.
I'm from Denver. Stand right here. Okay, now take your shoes off, too.
We need him to work today, okay?
Yeah.
Whatever you do, I need him today.
All right. So this is the manager. Now, this is part of the benefit of the hotel. Now, let me tell you. See, I'm not even charging these guys. You know what? Because we charge a lot to do this. But you know what? I want to tell you what kind of Cabernet I like, okay?
Yes.
So they'll bring it to my room.
Take care.
Okay. All right,
Just
face
staying
me.
here?
Yes, of course.
Don't worry.
Of course.
We got
Face
you,
me,
we
face me.
got you covered.
Okay, very good. Okay, now step in place.
Okay, Fred?
Okay, now just stop and relax. Okay, now I'm going to check your hip. Just stop. Okay. Zach, come here real quick. Now, look, film down at my hand. Can you see how this hand is more forward than this hand? Can you see that, Zach, on the video? Yeah. This hand is more forward. You see it? Yeah. Can you look down at my hand? Do you see how this one's more forward? Mm-hmm. Your hip is twisted. When your hip is twisted, the joints in the back right here are going like this. Pressure. You see how your foot on that side is flared way out? Mm-hmm. Okay, because part of the problem is your feet. Okay, you've got pronation. It's not good. Look straight at me. Okay, now lay in your stomach, put your head over there. Okay, a little twisted here, okay? So once again, his leg length is good, but he's got rotation, okay? So he's got a negative Y rotate, or a positive Y rotation. He's forward on the right hip, okay? So we're gonna look and adjust his knees first. Let go. Now the sciatic nerve runs right around the knee, so it can affect you right up in here. Okay, he's good. His sacrum is twisted and is shifted to the side this way. So we're going to adjust in here. He's good there. Oh, he's twisted like crazy, right? Feel that? You feel this? Mm-hmm. Is this where you hurt a lot, right?
Yeah. Yeah,
you're all twisted here. Okay. Now again, what we want to do is always confirm these with X-rays. So posture checking is good. You know, I mean, we can do emergency stuff, things like this, but you really want to get a handle on what's the neck curve look like? What are these, how deep is the translation? We measure the things like I show on my video, Adjusting with Certainty, and that will give people an idea of kind of what, or it gives you an idea of exactly what you need to be doing. Breathe out. Breathe out. Okay, now, lay on your side facing me. Lay on your side. Okay, come to me closer. Okay. I'll lean your shoulder. So I'm going to take his fifth lumbar. Put this leg straight, this one straight. Straight. Okay, now just relax. You might hear some noise. Relax. Stretch. Okay. Go to the other side. Okay. Just push this one straight. So I'm taking the fifth lumbar, bringing the hip up. Okay. Now, one more time, I'm going to have you going on this side. Okay. I'll bring this leg straight. Let's make sure I don't have anything left here. Okay, get up and walk around a little bit. Just walk over there. walk, come back. Okay, now I'm gonna check. Okay, so I want you to lay back on the side facing me, okay? So what we want to do here is put your legs kind of straight and roll towards your stomach. Roll onto your stomach, roll onto your stomach. Okay, so we've got him now for the positive Y. Okay, so I'm gonna pull his pelvis. We're gonna roll the whole pelvis forward because don't forget, his pelvis was too forward here. So we're gonna lift him up like that, rock the whole pelvis. Now walk. How's that feel?
That feels good.
Feels good. Chiropractic's phenomenal. I mean, it works. Come here. Where else can you do something? You can't. What are you going to do? Surgery in the middle of a hotel? Step in place. Look at me. Okay. Now, look down at my hands. You see how they're even now? See the even? This one was out here. Do you see how they're even? Do you see that, Zach? Okay. Lay in your stomach and just check your feet real quick, and then you're done. So I got his knees. We're going to do his feet a little bit. Always checking that. See that? A lot of alignment right there. Right here. Not moving real good on this first knuckle. Okay, you're done. So you need to get with something because you see you got a hip that's twisted. And then there's exercises. What you would do is you would stand with your back to the wall and you push your right butt against the wall. You hold for 3 to 5 seconds. Like this. Right butt. Stand up.
Okay, let me do it right here because I'm
okay. He's going to show you. No, stand up, stand up. Okay. Just stand with your back. Remember, this hip was too far forward.
Right.
So you try to push the wall down with your butt. Hold for the count of 3, release. Do again. Hold for a count of 3, release. So you do that 25 times, maybe a couple times a day. It's going to be great. But you should see a chiropractor. I'm in 1057. Cabernet, 105.
Take floor.
Nikitow, yeah.
1057.
This is how I get my red wine. Okay,
all right, from there.
Okay, yes sir,
I appreciate it. Thanks
no
so
problem.
much.
You go tell your manager to get the rest of the gang down. It works. I mean, it's like, you know, we go to hotel, people see this, but you know, this is how you educate a lot of people. Because what I'm going to do is I'm going to get his name and number. I'm going to refer him to a chiropractor out here in Orlando that does this 3-dimensional system that I teach. So, guys, that's chiropractic, and that's how you do it. So, Dr. Nikitow signing off.